actually was meant to buy some enough time for government to upgrade the healthcare system, so that in an event we are having a surge of cases, we can be in a position to manage them. It's an emergency, we are dealing with a particular situation that has emerged. Actually, we are mitigating the risk, but when it comes to a disaster, you mitigate the impacts. It's something that has already now overwhelmed that particular capacity of a government. COVID has a health face, since it's a pandemic and we classify it as epidemiological hazard.
Close to 104 million Malangan or worth of contribution has been made. And this is in addition to what also government put aside in response to this COVID. So other than just what government put aside, we have been able to mobilize this, and we are still calling for more.
That's incredible.
Basically, at National Disaster Management Agency, we've been trying to come up with a strategy of integrating business into DRR. So this partnership with the National Resource Mobilization Committee actually has given us an opportunity to ensure that we facilitate the engagement even prior to the evolution of the strategy.
First of all, let me just once again appreciate those individuals, the churches that have made a donation. Some have pledged cash and some have honored their pledges, and they've already flown into the bank account of the response, COVID response, which is at Standard Bank. And so what we are doing, so that the money, the intention is not to keep the money sitting in the bank. So as long as the cash pledges are redeemed, we wait upon NDMA to say there is a need there. Then we disperse the funds, we buy those goods and services that are required, because there is a priority list that NDMA has. So we are not shooting in the dark. They've given us and said, you know, the PPEs are important, beds, sanitizers, there were a number, and the priorities change. As people are donating, the focus shift in a particular direction.
The Ministry of Health really is geared towards ensuring that the testing capacity of the country is being upgraded, as well as the testing itself for COVID-19. So there is a requirement or an urgent need for rapid testing kits, as well as an urgent need for surgical beds, because we want to increase the bed capacity so that when we experience a surge of cases, we can be in a position to isolate people and then treat them. And maybe, may I highlight that the government is leading even the recovery efforts for the country. Government already has established several committees in respective sectors of the economy to establish some strategies to recover the economy, as well as to ensure that we sustain the economy even during the advent of COVID.